Surgical Theater is proud to introduce our Surgical Navigation Advanced Platform, or SNAP. The SNAP utilizes the same preoperative imaging in the form of MRIs and CT angiograms that you use for your patients and gives you the ability to integrate that with your navigation system and review simultaneously different points of view in the operating room. One view might be from the microscope point of view. An additional view may be from the deep tumor margin or adjacent to a vital structure. Here we're integrated with the navigation system and we can see our probe projected simultaneously on the SNAP and on the navigation system. The SNAP gives you the ability to appreciate multiple different views simultaneously. Here we have the ability to quickly scroll between sagittal, coronal, and axial views. We can easily switch these to the alternative view, such as posterior of the head or inferiorly, or the reverse sagittal. In addition, we can clip or adjust the images to visualize different portions by clicking the arrows. To customize tissue segmentation, we have this feature here, which gives us the ability to adjust tissue thresholds to better visualize tissue during the procedure. We have the ability to paint tissue, which can be turned on and off with this key here, turning off the painted tissue in the area of interest. In addition, we're able to save our tissue segmentations on the multiple screens and scroll through them in the surgery to visualize different structures. Here we have them labeled transfer function 0 through transfer function 3, and we're able to adjust them as they've been previously established in rehearsal and preparation for our surgery. The SNAP has multiple different features for the probe to enhance your intraoperative navigation experience. For example, you can see here there are scale measurements on the probe for 1 centimeter, which can be turned and off by the application of this button here. In addition, we have multiple probe extensions. For example, we have a stereotactic or trajectory planning probe extension here highlighted in yellow for planning your endoscopic procedures, your ventriculostomy, or your biopsy tracts. For example, if our entry point for biopsy is here, you can see where your needle is going to go, or for placement of your ventriculostomy. We have a sidekick probe for measurement purposes. The sidekick can be positioned and rotated at various angles by scrolling. In addition, we have the ability now to measure how much deeper there is to resect for the tumor, or how far the tumor margin is from this vessel here. With the ability to customize segmentation for individual cases, here we have a tumor case, and we've made the tumor transparent, and we're able to visualize where we are relative to the, for example, carotid arteries and the middle cerebral artery and the anterior cerebral arteries here. And here we have good visualization of the internal carotid artery with the middle cerebral artery coming over top. Now we've transitioned to a vascular case, which can be useful for aneurysm cases and AVMs, and here we have an aneurysm case. We have the ability to adjust tissue segmentation here to make the vessels transparent, so you could very clearly and carefully analyze the aneurysm neck, which can be seen here. Additionally, we have the ability to very carefully evaluate the adjacent parent arteries and other vital structures with the clear segmentation. And we have probe extensions, which can enhance the operative experience. Here we have a measurement generic aneurysm clip projected at the tip of the probe, which can be rotated for measurement purposes and evaluation in the procedure. We have an extensive clip library, which features a variety of common clips that you would use in the operating room, which can be projected at the tip of the probe for trial purposes prior to actually placing the clip. And here we've selected a clip. We have the ability to analyze where the clip is in relation to the aneurysm and the parent vessels. We can rotate and adjust it. And we have the ability to freeze, zoom, and we can rotate the images to see where our aneurysm clip times would be, for example, on the posterior portion of the aneurysm. And with the endoscopic probe view, we have the ability to represent what we would see on the screen at the tip of the probe. And this gives us the ability to appreciate, rehearse, and plan for endoscopic procedures. Here we have an additional aneurysm case where I'm demonstrating the segmentation properties and clear segmentation for vascular cases. And here we have a vertebrobasilar junction aneurysm, and I'm looking down the surgical corridor which we placed, and you can see the vertebral aneurysm here, and I can rotate this to see the other side of the anatomy. And here we have clear tissue segmentation for the vessels, which gives us a very good look at the origin vessels and the neck of the aneurysm, which you can see here. This concludes our introduction to the SNAP. For additional information about our team and products, please visit our website.